Inside a quiet hospital break area, Dr. Vikrant and Dr. Poonam compared their recent patient files, noting a specific pattern emerging in the clinical data. They were seeing a consistent influx of long-term diabetic patients whose creatinine levels had spiked into a dangerous range, despite the fact that these patients had reported no prior pain or warning signs. This is the reality of the connection between diabetes and the kidneys. The early stages of the disease are completely silent because the organ lacks the pain receptors to signal that it is under stress. Visible symptoms like severe fatigue or distinct swelling in the feet, clinically known as edema, appear only in the final stages. Relying on physical discomfort as a guide often means the disease is only discovered after significant damage has already taken place. Patients often ask how sugar in the bloodstream can physically damage a separate organ like the kidney. A healthy kidney's massive filtration network consists of millions of fragile capillaries. High blood sugar acts like jagged particles, scraping and leaving deep scars along these delicate walls. This scarring process, diabetic nephropathy, causes damaged vessels to turn dangerously rigid. High blood sugar is more than a chemical imbalance. It actively and physically dismantles the kidney's microscopic architecture. Because the scarred kidney works harder, its delicate filtration membrane stretches under pressure until it physically tears. The first measurable sign of structural failure is a protein called albumin slipping through those microscopic tears into the urine. But the damage does not stop there. A second threat soon enters the cycle: rising blood pressure. This creates a vicious feedback loop. The damaged kidney causes the body's blood pressure to spike, which then acts like a battering ram, returning to cause even more rapid tearing of the kidney's vessels. Without intervention, this physiological trap creates a self-accelerating cycle of organ failure. A common misconception among patients is that a normal result on a standard basic urine test means their kidneys are safe. Standard tests can overlook the early stages of decline. Breaking the cycle requires proactively searching for microscopic indicators of leakage before any outward symptoms arise. This is why specific medical protocols are necessary. Patients with diabetes require an annual microalbumin and GFR test to detect that invisible protein leakage as early as possible. Dr. Vikrant and Dr. Poonam finished their review of the data, knowing that this specific screening protocol is the primary tool for delaying or preventing total kidney failure. Because the kidney is the ultimate silent victim of diabetes, specialized proactive screening is the only effective defense.